Hi everybody, my name is Dr. Scott Giacomucci. I'm the director and founder of the Phoenix Center for Experiential Trauma Therapy in Media, Pennsylvania. I'm board certified in clinical social work, in sociometry, psychodrama, and group psychotherapy, and my specialty is in trauma and traumatic stress. I'm really excited that you found this video, and I hope that you do find it helpful in your work. So in this video, we're going to be talking about trauma-informed principles. So in the past few years, it seems that the term trauma-informed has become more and more popular. We're having more and more discussions about trauma and the ways that it impacts people, which is great. But I've also seen some problems in that all of a sudden everyone is claiming that they're trauma-informed. Every agency, every marketer that I talk to is talking about their organization as trauma-informed, their program as trauma-informed. And I'm a little concerned that we're not all using the word trauma-informed in the same way. So I wanted to create a video getting back to basics and presenting the 6 trauma-informed principles developed by SAMHSA, the Substance Abuse Mental Health Service Administration. So before we start with those 6 principles, I want to take a moment and differentiate the difference between trauma-informed and trauma-focused. So I think this will make the conversation a little more clear. When we're talking about trauma-focused services, what we're talking about are services that are directly focused on treating PTSD and addressing the impacts of trauma. However, when we talk about trauma-informed services, this could be a term used really in any organization or agency within the social services field or outside of it. So this could be a law office, this could be a hospital, this could be a university or college, this could be a treatment center, this could even be a larger system, like a city, a trauma-informed city or a trauma-informed state. So trauma-informed describes the process that services are provided, whereas trauma-focused is more describing the content of the actual services. So when we're doing trauma-focused services, the focus is on trauma. And when we're providing trauma-informed services, the focus might not be on trauma or PTSD, but the way that those services are provided takes into account the ways that trauma impacts people and specifically focuses on the importance of safety and preventing re-traumatization. So while these 2 terms are similar, it's important to acknowledge their differences. I would even argue that there are some agencies, some programs, some providers that I've heard of who are providing trauma-focused services, but do not appear to be doing it in a trauma-informed way. So just because a provider is saying that they're treating trauma does not mean that they're doing it in a trauma-informed way. I've been really disappointed, honestly, in the field, in that the longer I've been practicing, the more and more I hear about ways that clients have been re-traumatized by therapists, by agencies, by programs that were set up to help heal trauma. So again, in this video, we're going to talk about trauma-informed principles. If you wanted to learn more about trauma-focused therapies, you could check out some of the other videos on my YouTube channel here. My expertise is specifically in trauma-focused psychodrama and experiential trauma therapies. So moving on to the 6 principles of trauma-informed practice, I'm going to outline them one at a time. The first one and the most important one is safety. So trauma is basically an experience that disrupts our sense of safety in the moment and oftentimes after that moment of trauma. One of the key characteristics of PTSD and post-traumatic stress is that it impacts one's sense of safety long after the traumatic experience is over. So in some ways, safety is the opposite of trauma. So when we're working with trauma, or we're providing other types of services to folks who may have experienced trauma, it's important that we're first and foremost establishing safety for them. So this includes physical safety, as well as psychological safety, emotional safety, and also taking into account ways that we can help people feel safe related to their identity, their religion, their gender, their sexuality, their race. So there's a lot of different layers of safety, and it's important that we're taking them all into account. Safety, again, is really the most important thing here. And when we talk about the trauma-informed principle of safety, we're not only talking about establishing and maintaining safety for clients, but also for staff and employees. Creating a safe environment where staff members and employees feel like they can speak up, they can be themselves, that they're not going to be harmed by others at the workplace. So safety really applies to everybody in this case. The second trauma-informed principle is trustworthiness and transparency. So when we're providing services to folks who may have experienced trauma, we're probably providing experiences to folks who've experienced relational trauma. They've experienced people who were supposed to be protecting them, nurturing them, offering them care, but instead we're betraying them, we're harming them, we're gaslighting them. People who they put their trust in the past who are not trustworthy. So the second trauma-informed principle is about correction in this regard, about the importance of integrity, of accountability, of being a provider who does what they say they do, and is transparent about how decisions are made. Especially when we're working with trauma survivors, it might take a little longer for trust to develop based on the nature of traumatic stress. So all the ever more important this principle is about being trustworthy, about being transparent. This can be employed in really simple ways, from having more descriptions on your website about why policies are put into place, about why things are priced the way that they're priced, about why and how your organization is structured or how decisions are made within the organization. Again, this principle also applies to staff. It's not only about how services are provided to clients, but also how decisions are made within the organization and how those are communicated to staff and employees. Can the frontline staff trust the administration and the leadership to make decisions that are in their best nature, that are in their best interest? Is the leadership and the administration transparent about how decisions are being made? So all of this goes into the second principle, trustworthiness and transparency. The third trauma-informed principle is peer support. So when we're working with trauma, again, so much of trauma is relational in nature. And there's a really powerful way that experiencing support from peers and providing support to other peers helps one feel empowered, helps one feel safe, connected, like they're not alone in their experience of trauma. And again, this principle applies not only to clients that are served by an agency or provider, but also to the staff. Are we creating spaces where staff members can support each other, can come together and address the impacts of burnout, of vicarious trauma, and to celebrate the successes, to celebrate the joy of the work that we do? So peer support is in some ways about creating community and fostering meaningful relationships between clients, between community members, and between employees and staff. The fourth trauma-informed principle is collaboration and mutuality. So this is similar to the previous. However, this trauma-informed principle is related to addressing the power dynamics that often exist within the provision of services, especially in the medical field and in the clinical world. There's a pretty clear power dynamic in that the doctor or the therapist is in a position of power and authority, or perceived power and authority over a client. So this trauma-informed principle instructs us to, as much as we can, while still being professional and ethical, to dismantle some of these power dynamics, to really treat the client as an equal, to treat the client as the expert in their experience, to collaborate with the client in the ways that decisions are made, to collaborate with clients in setting treatment goals, to collaborate with clients throughout the entire process, to really co-create and be co-responsible for the work that's being done, while having a mutual respect. Now, as a psychodramatist, this is really core to Morenian philosophy, Moreno being the founder of psychodrama. Moreno is a bit of a radical in that he really tried to dismantle some of the power dynamics within the field of psychiatry and within the psychotherapy fields. He argued that every patient in a group, in a community, had therapeutic power, therapeutic agency. That in their own way and in their own right, every patient was a doctor, was a therapeutic actor and agent. And that as professionals, as group facilitators and community leaders, our objective is to tap into this mutual aid, to position clients, to position group members, to position employees in ways that they can contribute to the healing of each other, the supporting of each other, the educating of each other. So this fourth trauma-informed principle is really aligned with my philosophy as a psychodramatist as well. If you wanted to learn more about psychodrama, I would encourage you to check out some of the other videos on this channel. The fifth trauma-informed principle is about empowerment, voice, and choice. And you can start to see as we talk about all these trauma-informed principles that it's sometimes hard to talk about them separately because they all overlap and are intertwined with each other. Empowerment is connected to peer support. It's connected to safety and collaboration and mutuality. The experience of trauma and traumatic stress is really disempowering. It feels like a being robbed of one's personal power, one's ability to create change within their life, to be autonomous, and to create change in the world. So when we're working with trauma survivors, it's really important that we consider ways that we can empower them to claim back some of the power that they feel like they've lost because of past experiences. It's important that we're giving them a voice and choice in the way that they're receiving services. When I work with trauma groups, one of the things that I talk about is how essential choice is. That because trauma so often does not involve choice, recovery from trauma has to involve choice. I really don't find it helpful to mandate clients or force family members or friends into trauma therapy. Forcing someone to do trauma therapy is potentially re-traumatizing and even harmful. A reenactment of power, a reenactment of harm. It's important that somebody's willing to do this type of work and choosing to receive trauma-focused services. So choice is really important when we're working with trauma survivors, whether it's trauma-focused or trauma-informed services. That we ask for feedback. We want to hear the voices of our clients, of our customers, of our employees. We elevate their voices. We take their voices and their choices into consideration. We ask what their preferences are. So this fifth trauma-informed principle, empowerment, voice, and choice, really is about helping clients reconnect with a sense of power and autonomy in their life. And the sixth trauma-informed principle is about respecting and acknowledging differences and issues related to culture, related to history, related to gender, race, sexuality, and all the different socially ascribed, marginalized identities. So when we're working with trauma, so often we're working with collective trauma. Folks that have experienced discrimination that have experienced harm simply because of the color of their skin, the gender that they identify with, the zip code that they were born into, their language, their citizenship status, their religion, or different aspects of their identity. So to be truly trauma-informed means that we're taking all of this into consideration in the way that we're working with employees and the way that we're working with clients, that we're not re-traumatizing folks or causing more harm related to misattunement in terms of race, in terms of gender identity, in terms of sexuality or culture. So again, these are the 6 trauma-informed principles outlined by SAMHSA. If you wanted to read more about these 6 trauma-informed principles, one of the resources that I can provide freely to you is my recently published book. This book is called Social Work, Sociometry, and Psychodrama: Experiential Approaches for Group Therapists, Community Leaders, and Social Workers. Chapter 7 of the book focuses specifically on trauma, and the entire book is actually published open access, which means you can download the 450-page textbook entirely for free online, and I will include a link to the book in the description below. So if you found this video helpful, I would really appreciate some feedback, to subscribe to the channel here, to comment on the video, and to stay posted for future videos.